this is the backdrop. So yeah, it's on the newborn week we are having, but Khanendra will take us through the agenda maybe in another few minutes because media is still joining. So yeah.
Swati, do we have at least somebody from the media so that we can start showing the film at least?
Yeah, Rajeshwari, people have joined from media.
Then we can start with the film and then they will join the rest.
Maybe another few minutes because media is still joining.
At least somebody from the media so that we can start showing the film at least.
Khanendra,
Start with the film and then they will join.
yeah, I'm just wanting Khanendra to 1 minute.
So Swati, why don't you welcome? Maybe Khanendra has a issue of connectivity. He's also muted.
Is muted? No, one
Yes.
sec. I'll just check.
But he was speaking just 5-7 minutes ago. I think he's
Yeah, that's why asked to unmute. I'm just asking him to unmute and then yeah.
Rajeshwari, good afternoon.
Good afternoon once again, ma'am.
Good afternoon. And today we are looking at each other the whole day, no?
Because it's the day of the newborn.
That's
Let's look at it like that.
yeah, it's the day. Lovely film, lovely program, lovely comparing, lovely talk. Nice, Rajeshwari. We like
Thanks to you,
Ma'am,
ma'am.
you did a wonderful job.
Thanks to you, ma'am.
Ma'am, you were really good, very interesting. Thank you, ma'am.
So we can start the film and maybe we'll just. Khanendra, are you back?
Yes, I'm back. I'm sorry that I was
Can you
talking
just
to Dr.
welcome
Paul Setter.
everybody, the initial thing, why we are together and all, then we start the film, yeah?
Okay.
Over to you, Khanendra.
Okay, thank you, Swati.
Please put your video on.
Good afternoon, everyone. Can you hear me?
Yes, yes, loud and clear.
Okay. As you all know, Government of India actually celebrates the National Newborn Week from 15th to 21st of November every year. And the expectation is that a lot of activities are implemented for promoting the maternal and newborn health. And this year also we have planned a lot of activities jointly with the Public Health Department and the professional associations. And this year has been very challenging for all of us because of COVID-19 pandemic. And it has been estimated that because of the direct and indirect impact of the pandemic, there is going to be increase in the maternal and under 5 and neonatal mortality rates. So how we can address these issues and how we can strengthen the health system. And when we talk of maternal and newborn mortality, it is a combination of the interventions at the family and the community level, as well as the interventions at the health system, which will help us in reducing the maternal mortality as well as the neonatal mortality. So the purpose of this entire media sensitization is that, and the panel discussion is that all of us, we have to join hands for preventing the maternal and newborn mortality. And media can play a big role in promoting those practices which actually improve the maternal health, the neonatal health. And we have been very privileged to have very eminent and senior public health officials and experts. And also the presidents of the professional associations of AMOGS, the Association of Obstetrician and Gynecologists, the Association of Newborn Specialists, the National Newborn Forum, the Indian Academy of Pediatrics, and lot of experts and lot of senior officials. So I welcome all of you. And the agenda is such that there will be, presentations and talks about the neonatal and maternal mortality, what is being done, what needs to be done additionally. And after that, there will be a joint statement of Government of Maharashtra, UNICEF, and professional associations of HAMOX, NNF, and IAP regarding the current situation of COVID-19, as well as what are the key practices which are to be implemented for reducing the neonatal and maternal mortality in the state. And this will be followed by the interaction with the media, and then we'll conclude the session. So welcome all of you. Now I'd like to show the film.
Divya, the sound. Divya, we are not getting the sound.
Khanindra sir is playing the video. Sir, can you just enable the option?
Khanindra.
Yeah. Shall I stop share and ask?
Sound. Yeah, just stop share and Divya can start sharing. Yeah.
Okay.
Thank you. Stop sharing. Divya, you can start sharing the screen, please.
Sure, ma'am.
Yeah. Thank you, Divya.
एक लहान जीव अशा जगात प्रवेश करणारे जे जग आनंद, आशा, आव्हान आणि संघर्षाचं आहे. त्यांचा प्रेमाने सांभाळ करणं, त्यांची काळजी घेण्यासाठी आपण खरंच पाहिजे तेवढे प्रयत्न करत आहोत का? आत्तापर्यंत महाराष्ट्राने माता आणि 5 वर्षाखालील बालकांच्या मृत्यूच्या दरामध्ये सस्टेनेबल डेव्हलपमेंट गोलचे उद्दिष्ट गाठले असले तरी नवजात बालकांच्या मृत्यूच्या दरात सस्टेनेबल डेव्हलपमेंट गोलचे उद्दिष्ट साध्य करू शकलेला नाही. आता 2 प्रश्न उद्भवतात. 1. लोक आरोग्य सेवांचा लाभ घेत आहेत का? 2. आरोग्य सेवा त्यांच्यापर्यंत पोहोचत आहेत का?
मेरा चेकअप साइनसाइटिस में हुआ था. मेरा खून 5 ग्राम था. हॉस्पिटल से गोली दिया तभी बढ़ गया थोड़ा. बाहर का खून कौन सा चढ़ाया नहीं.
अस्पताल में सोचे रहे ले जाए के तो इनका रात में दर्द होने लगा. 1:03 पर पैदा हुआ है. तब हम सब दर्द भयल तो गए गाड़ी आने, तब से यहाँ बच्चा गिर पड़ा.
रक्तक्षय आणि कमी BMI ह्या समस्या भारतीय मातांना भेडसावत आहेत. योग्य काळजी न घेतल्यास कुपोषणाचे हे चक्र चालूच राहू शकतं. ते तोडण्यासाठी नवजात बालकाच्या आयुष्यातले पहिले 28 दिवस खूप महत्त्वाचे आहेत. या कोविड-19च्या साथीच्या रोगामुळे असं म्हटलं जातंय की भारतासहित अजून 118 देशांमध्ये आरोग्य सेवेचा तुटवडा आणि कुपोषणामुळे 5 वर्षाखालील मुलांच्या मृत्यूच्या दरात दर महिना 9.8 ते 44.7% आणि मातांच्या मृत्यूच्या दरात 8.3 ते 38.6% वाढ होण्याची शक्यता आहे. मग आपण नवजात बालकांना कसं वाचवू शकतो?
Ensuring quality, equity and dignity of newborn care at every health facility and everywhere is the focus of the National Newborn Week that is celebrated in India every year between 15th and 21st of November. The first day of life and the first 28 days of the child's life are very critical for the child's survival. In fact, there is no other period in the child's life which is more critical to the health of the child than the neonatal period, which is the first 28 days.
एक तर संस्थात्मक पातळीवर आपण काय काय कामं करणार आहोत. त्याच्यामध्ये डिलिव्हरी झाल्यानंतर पहिले 48 तासामध्ये आई आणि बालक जेव्हा ते हॉस्पिटलमध्ये असेल तर त्या ठिकाणी कशी काळजी घ्यायची आणि त्यानंतर डिस्चार्ज झाल्यानंतर बाळाची काळजी घरी किंवा गृहभेटीद्वारे किंवा कम्युनिटी लेवलला कशी काळजी घ्यायची याबद्दलची पण आपण कार्यक्रमाची अंमलबजावणी करणार आहोत.
Neonatal care is still an area of concern, and as per the theme also, we have various steps to increase the survival rate. This includes facility-based neonatal care, that 3-tier system that we are doing, and home-based and intensive home-based neonatal care. And as far as urban areas are concerned, the early initiation and exclusive breastfeeding is still to be improved when compared to rural areas. That will be our focus area this year.
एक सुदृढ नागरिक बनवण्यासाठी एक चांगलं आरोग्य असणं खूप गरजेचं आहे आणि आरोग्य हे एका दिवसात तर नाही होते. म्हणजे लहान शिशु आणि गरोदर स्त्री हे जर हेल्दी असतील, त्यांचं आरोग्य चांगलं असेल तरच एक नवीन पिढी आपण पुढे आणू शकतो. आणि प्रत्येक शिशु किंवा बाळ आहे त्याची जबाबदारी ही त्या आईवडिलांची नसते, तर प्रत्येक समाजातील प्रत्येक घटकाचं असते, समाजाची असते.
After these urban primary health centers, we have to strengthen the secondary and tertiary health also. And especially in urban areas, we have to integrate these 3 facilities, primary, secondary and tertiary, so that we can continuously follow from the primary health to tertiary health in complicated cases.
Let's commit to a world where there are no preventable deaths of mothers, of infants and stillbirth, where every pregnancy is planned and wanted, every childbirth is celebrated, and women and children develop to their full potential. In a state like Maharashtra with growing urbanization, this is a good time to focus on strengthening the urban primary health care system to make it more effective and friendly.
संबंधितांनी नियोजनबद्ध हस्तक्षेप केल्यास आपल्याला एक निरोगी कुटुंब मिळू शकतं. ही आहे चंदन शिवे परिवाराची गोष्ट.
मेरा नाम शेखर शामू चंदन शिवे. मेरा पहला बच्चा जो माई मैटरनिटी होम में ये हो गया था डिलीवरी. वहाँ पे हॉस्पिटल में ऐसा फैसिलिटी है, कुछ प्रॉब्लम नहीं है. सब डॉक्टर, स्टाफ, सिस्टर्स, बाकी सब उन लोग देखभाल सब कुछ करते हैं. इन लोग
रूटीन चेकअप 8 दिन में 15 दिन में बुलाते हैं उन लोग. आयरन वगैरह, हिमोग्लोबिन वगैरह चेक करते रहते. इधर आएगे तो आणि टीटीचे इंजेक्शन पण मी घेतले सगळे, दोन्ही पण इंजेक्शन माझे झाले.
उनके टाइमिंग रहता है, ओपीडी का टाइमिंग रहता है. वो ओपीडी में कुछ उसको तकलीफ होता रहता है, हम लोग की बीएमसी की संस्था है उसमें हम लोग जाके विजिट कर लेते हैं.
हीमोग्लोबिन थोड़ा सा कम हो गया तो उनका शुरू हो गया सब क्या क्या खाने का, ये खा वो खा चालू ही रहते. आणि खरंच माझे मिस्टर भरपूर काळजी घेत. माझा नवरा खरंच चांगला माझ्यासाठी लक्की आहे मी.
Now, may I request Rajeshwari Chandrasekhar, the Chief of the Field Office of UNICEF, to make a short presentation on the progress of the Sustainable Development Goal 3, focusing on maternal and child health in Maharashtra and the UNICEF support for achieving these goals in the state. Over to you, Rajeshwari ma'am. Rajeshwari? Can you hear me, Rajeshwari?
Yeah, Rajeshwari has shared the screen, but has she muted?
Okay, can you hear me now?
Yes. Yeah, we can hear you.
I think I had forgotten to unmute. Okay, is it clear now? My voice is audible?
Yes.
Yeah, your voice is audible now.
So I was just saying that a warm welcome to all the participants from the professional associations and the Directorate of Health Services in Maharashtra. Actually, this morning we had a very good panel discussion on urban primary health care, and some of them are also relevant to this meeting that we're having in the afternoon. And this time the audience is, of course, all of you who are representing the professional medical associations, as also a lot of media personnel who are here. And like my colleague Khanindra said, I will take you through what has been the progress of SDG 3, which is on promoting healthy lives and well-being. If we were to just look at what how we fare with reference to the country in terms of the maternal mortality ratio, you can see from the left side of the graph that we are way below that of the country. The country is still at 113 deaths per 1 lakh live births, but we are already down to 46. And if you look at what were the SDG targets for MMR, we have already achieved it way back in 16 to 18, whereas we were to achieve it only by 2030. So in a sense, we've already achieved the MMR target of 70 per 1 lakh live birth. When you go to the right side, we are showing you the under 5 mortality, we're showing you the infant mortality, and we're showing you the neonatal mortality. Now, the target for under 5 mortality, according to the SDG, is 25. And as you can see from this graph, we are already at 22 as of 2018. So in a way, even the under 5 mortality rate for the state as a whole, we have achieved. What is of concern is actually this one, which has kind of stagnated, which is the neonatal mortality. And hence this cause for this discussion today, both in the morning and now in the afternoon, and as part of the National Newborn Week, where we're trying to look at what can we do to save the lives of newborn, if indeed we are still at 13 per 1,000 live births. And when I convert this into actual numbers, what it means is that for every about 42,000 children below the age of 5 years, they actually die, and they die because of preventable deaths. Although we still say that we have achieved the SDG target and we are at 22, it actually translates into 42,000 children below the age of 5 who die. And of them, about 25,000 die within the first 28 days. And that is why we are finding this has plateaued over us 2015 to 18. It has got stuck at 13. So somewhere something is not reaching, either in terms of facility or in terms of a demand from the community. And to add to the agony, we have about 900 mothers who die every year due to preventable deaths. So the death of children and the death of mothers is all preventable. And that's what makes you feel that this is something very much in our hands, in your hands as professional associations, to take this agenda of neonatal care and newborn care forward. And I'm sure, as we all know, with the COVID pandemic, these gains that we have achieved and we are able to show you now as of 2018, maybe a year or two later, we might have reversed all the gains because of the food insecurity, because of the loss of livelihoods, and because of the disruption in the continuity of essential health services. Now, who do we focus on as we go forward in terms of the neonatal care? We all know that we are the second largest state in the country after Madhya Pradesh, with the largest tribal population, and it comes with its own issues of access, connectivity, and also people's perception of health-seeking behavior. And that is something we have to address. The second issue, and this is, I would like to quote what Dr. Satish Pawar, the NUHM Mission Director, said in the morning, that he said, normally people think if you build a health infrastructure in urban areas, it will benefit everybody. But that urban is actually masking a lot of disaggregation, masking a lot of disparities, especially when you zoom down to the urban slums. Agreed, we have a large urban population in this state, but the fact that a bulk of the urban population live in slums, almost 45%, is something that is going to be a challenge for the health managers and the health policy planners in how to reach essential services, health services, to the urban slums. A related issue is of the low levels of anemia and the body mass index, which is also aggravated by the neglect of the girl child, the early marriage. And we have seen in COVID times how young girls are forced into getting married, so that for the parents, it is one burden less on their shoulders. And so she can get married to somebody almost double her age, so long as she is out of the household. So this is what is actually causing a further neglect of that girl child, leading again to early pregnancy, early motherhood, young, too early to be born, too young to be born, and too small at birth. And hence issues of neglect of the girl child is very important. Now, when IMR, U5MR, we are doing pretty okay. When you look at just one indicator, which is the prevalence of low birth weight, then there we find that actually we are much higher in terms of the proportion of children who are born less than 2,500 grams at birth compared to the national figure. National is only 18, but we're already nearly at 20%, and that is a cause for concern. If I were to look at Maharashtra along with comparable states with similar U5MR, and you look at women who are 20 to 24 years who are married, but they were married before the legal age of 18 and they got pregnant within the next 1 year, then this is where Maharashtra is compared with the states of Tamil Nadu, Goa, and Kerala, where we have more than a quarter of our women married early, got pregnant within 1 year, as compared to less than 10% in Kerala and Goa. When we look at mothers with full antenatal care, again, you have Maharashtra with less than a third of them receiving the full antenatal care as compared to Kerala and Goa with over 60%. And when you look at children who are fully immunized between the ages of 12 to 23 months, again, you see that Goa and Kerala is way above 80% and we are the lowest at 56%. Yes, it is NFHS 4 data, but that's the latest that we have to quote. And therefore, this is the way that we will have to focus on our state when we compare with comparable states. Going further ahead in terms of what do they have as complementary feeding at the age of 6 months to 23 months, we find that less than 10% of our children 6 to 23 months actually receive a dietary diverse diet, which will help them grow up to their full potential. It's only 6.5, whereas Tamil Nadu has more than 30%. Looking at stunting, again, we are the state with more than a third of our children under 5 years who are already stunted. And finally, if you look at women's maternal nutrition, then in terms of how many of them are having low BMI, again, we top the list among the same 4 states that I have been consistently comparing with. And here we have nearly a quarter of our women in Maharashtra who are already starting the battle of motherhood with a low BMI. So it will have its own ripple effect in terms of consequences later on. So the purpose of showing this to you is if the 900 preventable deaths of women are happening, this is where the causes lie. If the neonatal mortality has remained stagnant, this is where the problems lie. How do we look back at this in totality rather than addressing them at specific siloed approach? In this context, then, what has been UNICEF's support for the health sector? We have helped in scaling up the training of the skilled birth attendants in the statewide. We've also helped in the Dakshata training in order to ensure quality of labor delivery. We have also supported the scale up of the facility-based newborn care. And earlier there was no SNCU software. We actually introduced it in the state, and that has helped to develop a monitoring system. We've also supported facility-based and home-based KMC in the state. And in the 4 aspirational districts of Niti Aayog for Maharashtra, which is Osmanabad, Latur, Nandurbar, and Gadchiroli, we have facilitated and saw to it that there's a multi-sectoral plan, which is now funded by the district budget for health, along with other sectors like nutrition, education, and WASH. Coming to the COVID specific response, because this has happened only this year, we have supported the Department of Public Health in developing what we call RCCE, which is Risk Communication and Community Engagement, through the IEC Bureau in Pune. We have supported in the very initial period of the COVID, the facility assessment along with WHO for over 500 such facilities. We convened a lot of interfaith organizations, be they Hindus, Muslims, Buddhists, Jains, Sikh, and others as well. About 20 of them came together to talk on ways to address stigma and discrimination associated with the COVID. Then, as part of the state government's campaign on Majhi Kutum Majhi Jawabdari, we supported the training of all the staff of MCGM areas on this campaign. Specific to Navi Mumbai Municipal Corporation, we've already launched last week the 100% mask use campaign, which is using all sorts of media, mid-media, mass media, and interpersonal communication based on a communication plan that has been validated by the Municipal Corporation. Oriented NSS staff and students of both Mumbai and Kolhapur universities on the issue of COVID, ensured continuity of RMNCHS services in the 4 aspirational districts, mainly through routine immunization, institutional deliveries, etc. And because we got some grant with COVID, we managed to introduce, demonstrate, and upscale infection prevention control, biomedical waste management, and having hygienic wash facilities in the 21 dispensaries and hospitals of the Pune Municipal Corporation. So as a result, now they've established the triage areas. They have established the biomedical waste management, and that this is something that you will get to see when you go there. And hospital staff, as also the managers and administrators, are very happy with that support. In closer to home in Bombay, we have supported and now implementing a multi-sectoral plan of action for COVID in the 2 wards of G North and M East, which at the peak of the corona in March, April, were actually the worst or the most highest hotspots, I would say, and that work is still continuing. Also, in terms of mental health and psychosocial response, we have set up in the psychiatry department of KEM Hospital a psychosocial support cell. And as of October end, we have reached almost 9,000, let's say 10,000 COVID patients, and over 5,000 caregivers, and nearly little over 400 healthcare workers through a helpline number. And so there will be a lot of calls made in order to track and reach the people with counseling. Going forward, as for us, as our financial year is the calendar year, I would like to present before you what we would like to support the Public Health Department in the government of Maharashtra for the next year, 2021. We would like to support for upscaling the antenatal care and the Lakshya program, focusing, as I had said earlier, on the urban poor, because that is what gets masked when you say about urban areas, and the 4 aspirational districts, to scale up the midwifery initiative that we started this year, to support the monitoring of the home-based KMC in all the 78 tribal blocks of the state, as also scale it up in the urban slums. We had started and we have developed and got it validated by the department, the tribal immunization strategy last year. And early this year, just before COVID struck us in February, we had also done the urban immunization strategy. So really now we have both the area-specific immunization strategies with stakeholders and accountabilities laid out. It is now for the corporations in the case of urban, and for the tribal development department in the case of tribal, along with public health, to take this forward. And we would like to continue our, in the context of the COVID vaccine that is going to come, or provide support to the public health department for cold chain and for any communication related to the COVID-19 vaccine. And last but not the least, definitely support for the urban primary healthcare program in selected cities of Maharashtra. Thank you so much.
Thank you, Rajeshwari, for a very nice presentation highlighting the UNICEF areas of support, the achievements, as well as the plan and the way forward. I'm sorry that Dr. Archana Patil, who was to speak next regarding the government response for promoting the maternal and newborn health, she is not going to participate. She will not be in a position to participate as she has some urgent meetings coming up for which she has participated, or she is busy in the department. So the next in the agenda was is Professor Nandita Palsetkar, who is the president of Association of Obstetrician and Gynecological Societies of Maharashtra. We are very privileged to have you here, ma'am. We'd like to request you to highlight the support provided by the AMOX for the maternal and newborn health promotion in the state, how you have contributed, and what is the plan in future. Over to you, ma'am.
Yep. Thank you, Dr. Karlandkar. I think it's wonderful, and it was really wonderful listening to Mrs. Rajeshwari Chandrasekhar. I think it was a fantastic thing that we are being helped. I'm just going to share my screen. Can you see my?
It's coming up. It will take some time.
Okay, that's right. Can you? That's what I wanted to.
Yes, now we can see your screen.
See the screen? Okay. I need to, Okay. So basically, what I'm going to talk about is the role of the physicians and obstetricians and gynecologists.
Ma'am, your voice is breaking.
Okay, 1 minute. I need to, stop share and not.
No, we can see your screen now clearly.
So
Yeah.
You can see the screen. I'm going to switch off my video so that it's better. Is this better? My voice?
Yeah.
So, Association Maharashtra OBI Society has been established in 1987. We are nearly more than 8,500 members plus. And our vision and mission of our me? I'm very slow. Yeah, I think you lost me. So I'm not going to share the screen. I'm just going to talk. Please let me know.
Yeah, that's better.
Okay.
Yeah.
Because otherwise it's just going off. So the whole idea, the vision and mission is to see that women and children are taken care of. And this association has actually worked. Was a beautiful study by Dr. Vinod Paul in 2014, which actually said that care during labor and childbirth will actually save maximum numbers. And I think what Dr. Rajeshwari has mentioned about how the mothers and the newborn care, the preventable deaths at least, are more than 50%, and they can really be prevented. Now, in Maharashtra, nearly 40% of the deliveries take care in the private sector. And actually, I want to applaud the efforts of the government of Maharashtra because they have joined hands.
Okay,
Dr. Patil is not here. He has joined hands with a private organization, which is a professional organization. And we have come up with standardization of care. We all know WHO says if you give quality care, our SDGs will be achieved. And so Foxy, our mother organization, which is an all India organization, has started the Lakshya Manyata project in Maharashtra. The government of Maharashtra is actually, it's a public PPP, and I want to thank Dr. Shrotri here for being one of the very active people in helping it. And what we have tried to do is that 41% of institutional deliveries which take place in the private sector should have equal standardization of care. And we've been, accrediting centers, and near more than 3 lakh deliveries have occurred in these centers. Secondly, we've been helping the Pradhan Mantri Surakshit Matrutva Abhiyan. Foxy has actively participated, and amongst a lot of our doctors are going and contributing and going for antenatal care. Then one of the first guidelines on preconception care in India was actually formulated by Foxy 2016. MOGS has now created a guideline for the COVID care. It has partnered with the Public Health Department and UNICEF for sensitization of all members in preconception care throughout the last year and this year. And by pandemic, how it has helped is a lot of private sector hospitals have been converted to COVID care hospitals. And all our doctors are actually going and delivering patients. A lot of them have been, taken in to deliver COVID patients. So we continue to give antenatal care, comprehensive abortion care, family planning. These are emergency services, and all my doctors have been available to provide these services to the women who really need them. Drafting guidelines for care and treatment of pregnant women who are COVID-19 positive was done as early in April, and they're being updated every month, and they're distributed to all our doctors. Training and sensitization of all members of AMOGS on COVID-19 treatment and care among pregnant women. And obstetricians and gynecologists have actually been providing service to COVID-19 positive pregnant patients. And we have, here I would like to say, unfortunately, we have lost a few people along the way. So AMOGS is really committed to scale up its efforts and its programs for providing services to women. We have a plan for the health system strengthening in context of COVID-19 pandemic, and we would like to support the vaccination of all members of AMOGS once the vaccine arrives. And definitely we are happy to help the public sector is being really taken care of by the government, and the private sector is something that we are working in, and we are very happy to have the government of India partnering us. And causes like prematurity, infection, these all can be the low birth rate can be prevented, and that is what AMOGS is targeting and educating all its members. They're having a lot of webinars, a lot of workshops, and a lot of certificate programs to help reduce this problem which we are seeing. Thank you. Thank you very much. Sorry, my signal is really fluctuating.
Thank you so much, ma'am. It was very, very enlightening for us to hear from you the tremendous amount of work that is being done by the private sector in the state, which has contributed immensely for reduction of the maternal and newborn mortality in the state. Now, may I request Dr. Deshmukh, Professor L.S. Deshmukh, to actually enlighten us about the role and the contribution of the neonatologists in the state for the reduction of neonatal mortality. Over to you, sir.
Am I audible and is my screen visible, Khanindra?
Yes, sir. You are audible and your screen is also visible.
Thank you. Very good evening, everyone. This is a newborn week starting 15th of November till 21st of November, and yesterday was a World Prematurity Day. And very aptly, I must appreciate that UNICEF has taken this lead to hold this panel discussion and bring together various stakeholders who are involved in the care of newborn babies. I mean, it is very good that all the people who are, all the organizations who are involved, like the FOXI, the IAP, NNF, UNICEF, NHM, DHS, all are involved. And I will be sharing my views basically from the angle of two things. One is an person or the professor who is working in the government medical college, public hospital, and secondly, as a part of the Maharashtra State National Neonatology Forum of India. Just a little background, ours is a tertiary care hospital with a very high delivery rate, 18,000 per annum. Admissions were 3,500 per annum, and we are having a 40-bedded level 3 NICU. We have a separate department of neonatology, which is the only department under Maharashtra government, and running a DM neonatology course. We are running fellowship since last 5 years. We'll do conduct regular trainings and research, and we are part of the NNF COVID, NNF as well as ICMR COVID registry. The state NNF, just a word about it, it is an organization quite old, and I'm seeing Madam Irani has logged in. She is the founder member of this state chapter and my teacher, my guru. And up till now, there are just, it has swollen like anything. It has gone up to 700 members across the state. So what is the role of neonatologists when it comes to reducing the neonatal mortality? He has a key role. Of course, neonatology, pediatrician and everything, looking them at separately is wrong. But the neonatologists, they are involved in establishing good NICU care, provision of level 3 care in particular for sick and preterm babies, quality improvement. They are involved in education and research and policy making. As we all know, the most common causes of newborn deaths in India are prematurity or low birth weight to the tune of 35%, followed by sepsis and asphyxia. And nearly 50% of the preterm babies are dying due to RDS. Now, this prematurity, LBW, is a very important contributor to neonatal mortality, as all of us know. And we can do a lot to decrease prematurity and low birth weight. But looking at some of the high impact interventions for improving newborn survival, there are two kinds of high impact interventions. There are group of interventions which are targeted or which are in the hands of the obstetricians, targeted to the mother, like use of antenatal DEXA, skin to skin, delayed cord clamping, early initiation of breastfeeding, and family participatory care. Whereas there are high impact interventions targeting the newborn babies, like neonatal resuscitation and training, safe use of oxygen, which means not giving 100% oxygen in neonatal resuscitation, giving 30% for preterm babies, starting with room air in term babies, use of express breast milk, either mother's own milk or a donor human milk, kangaroo mother care, and rational antibiotic use. Of course, all of these interventions does not mean that they occur in the level 3 or level 2 units. All of them, they can be practiced at any level. So at the birth of the baby, I will just share few of the things related to those high impact interventions which we are practicing since last 2-3 years. One is bundle at the birth. I call it as a triple bundle. We do delayed cord clamping, we do skin to skin contact, and we do early breastfeeding in the labor room itself. And really this has helped us in a big way to improve the early breastfeeding rates. Because next thing is the beginning of breastfeeding within 1 hour, which is very important. It is like giving life with life. And if you look at the association of early breastfeeding and the mortality, we can see earlier we start, better it is for the baby for reduction of the mortality. And our rates, which were dismal around 30%, 40%, they have gone up to 60%, 70% with approach of this triple bundle. But unfortunately, as we all know, the COVID has disrupted that and everything is in tatters now. Another thing is a skin to skin. It is not a KMC, but it is skin to skin at birth. KMC, of course, has transformed the care of the low birth weight babies. It has reduced the burden of the NICUs, and it has helped the nursing staffs in big way. The mothers are happy, the nurses are happy, and the babies are going home very early. So I must emphatically say that kangaroo mother care should be adopted at all levels of care, whether you are tertiary level or quarterly level. Without KMC, the unit should not be recognized. And in this regard, I must say one word about UNICEF, that UNICEF is supporting us in big way for promotion of this kangaroo mother care. 2 years back, the UNICEF has recognized our center as Center of Excellence for Kangaroo Mother Care. And we are now in a process of establishing a 35-bedded KMC ward, separate KMC ward, which will be having few beds of MNCU, maternal newborn care unit. And we are very thankful to the UNICEF for that support. And as we can see, our KMC rates, our number of hours per baby have gone up and they are being sustained. One important thing which I want to emphasize on this occasion is quality improvement. Now, only way from here onwards, I will say, of delivering a medical care is use of quality improvement. If you are not giving quality care, then that is not a medical care. And I had seen myself, I have experienced in my unit since 2017, our unit is actively involved in quality improvement. Lot of nurses, lot of trainees have been trained in quality improvement, and we are working a lot since then, and we are part of a private network at national level, that is NQOCN, and we have been training other medical colleges also. And it's a very simple approach, and my appeal to all the stakeholders and the DHS and the NHM, including Madam Patil, is to introduce this quality improvement at the SNCU levels. In fact, 2 years back, there was a proposal which was prepared with the advice of the madam only, but unfortunately that fizzled out. I think we can take it next year also. So we can see some of the examples of this. Our follow-up OPD has gone. This is another weak link in the NICU care. Though we are running tertiary level care, our follow-up was very weak. Just 20-30% babies were following up. And we were not knowing what was happening to those babies once they go home. Many of them, they were dying. Many of them, they were developing disabilities. And only through follow-up, we will come to know what is happening to those babies. And now our follow-up rates are quite acceptable, I should say. Our unit is actively involved in FBNC training since last 5 years. We are training on-site also, as well as we are giving classroom training. I just want to share 2 initiatives which our unit has started through CSR. KMC, which I already mentioned, the work has started. Human Milk Bank, through the Rotary, our work has already started and it will be established very soon in 1 or 2 months. During COVID times, we are faced very tough time to maintain the non-COVID services as well as to provide the COVID services to the newborn babies. And for organizing the care of these babies, we had challenges in terms of segregating the babies, rooming in, healthcare worker management, feeding of these babies and the testing. But I must mention our unit, we started giving direct breastfeeding very early in the course of COVID-19 because initially 8-10 babies, we saw that giving top milk was quite messy and we thought that this is not meant for us and we will directly go for the breastfeeding. And 80% of our mothers who are COVID positive, they are willingly breastfeeding the baby. And fortunately, none of the babies have turned positive subsequently. And the NNF, FOXI, IAP is involved in the formation of the guidelines, which was released. Second version was released in May 2020 for perinatal neonatal management of COVID-19. There are challenges, there are gaps, which are usual for most of the public hospitals. But for us, I must mention here that in Maharashtra, there are 2 streams of health services, or the medical education is one, and the health services is on the other side. So the funding wise, the staffing wise, everything is little different. Lot of differences are there. So my appeal to all the authorities is that let us have some cohesion, coordination, and cooperation so that we can together make a lot of difference. We always face challenges of this overcrowding, understaffing, availability, equipment maintenance. There's no support for research. Follow-up services are non-existent in most of the setups. So my key messages for reducing neonatal mortality and improving survival are: prevent LBW and prematurity through good preconception and antenatal care, which helps in many ways by reducing LBW, reducing maternal mortality, reducing stillbirth rate, reducing neonatal mortality, birth defects, and also preventing some of the adult diseases. Then practice high impact maternal and neonatal interventions, which I shared. And it has to be always a joint effort by healthcare workers, health systems, and the community. So community engagement is another part which is lacking. And in times of pandemic, it is very important that we engage the private people also, more so in these difficult times because of the human resource constraints. And in this, I assure, and we are always involved from the NNF, wholeheartedly we are committed to the cause of reducing the newborn mortality. Thank you.
Thank you so much, Professor Deshmukh, sir. It has been our privilege to participate and partner with your medical college, the Department of Neonatology. We started with the SNCU software, then the Center of Excellence for Kangaroo Mother Care, and then we planned the quality improvement initiatives, which didn't take off, but then maybe we'll keep on trying and someday it will happen or it will take off. Now, may I invite Professor Pramod Jog to actually guide us about the contribution and role of the pediatricians, because in Maharashtra, in most of the places, the neonatologists are not there. So in those situations, the pediatricians only have to manage the sick and small newborn babies. So may I request Dr. Job to guide us as to the contribution and the role of the private practitioners, the private pediatricians, as to how we can improve the maternal and neonatal and children's health in the state in the midst of the COVID-19 pandemic. Over to you, sir.
Yeah. We have to stop screen sharing also, no?
Yeah. You can stop the screen sharing because I will not be using slides.
Okay.
So it
Kalendra, you can do that.
Yeah. Actually, may I request Dr. Deshmukh sir to just stop screen sharing?
Dr. Deshmukh has to stop the screen sharing.
Yeah.
Yes.
Okay. Very good. Now, I hope I am audible and visible. Yes.
Yes, you are.
Okay. Thank you. So it's going to be a heart-to-heart talk. See, I always feel that the government and the UNICEF, they are the left side of the brain, and pediatricians, obstetricians, they are the right side of the brain. Of course, with a bit of a partiality, because right side of the brain is associated with creativity. And my teacher, Mrs. Fadke, and maybe myself also, we are the joint between the two. And I can see Dr. Mrs. Aparna Shrutri also. So all our colleagues in the private sector, maybe they are very much needed to increase the authenticity of the programs of the government. And I always feel that IAP, that is our Indian Academy of Pediatrics, basically has three things: the intelligence, the authenticity, and the pyar for children, that is the love. But we don't have is another IAP, and that is infrastructure, then the ability to be together, and also the power to exert our actions. So there are certain things which we need from the government and the UNICEF, and there are certain things which we probably would contribute with the help of our ideas. And IAP is very, very active. And I call pediatricians as the adolescent and the child health ambassadors. And I would say that every pediatrician who is a member of the Indian Academy of Pediatrics has to be a big pediatrician, BIG, big. And the IAP is trying hard for every pediatrician to become big. Big stands for, it has an important meaning, and all the pediatrics is probably concentrated in these three alphabets. So the B stands for problems related to the birth, breastfeeding, and bal nutrition. It's not malnutrition, it is bal nutrition, that is the childhood nutrition. I stands for immunization champions, and G stands for growth and development geniuses. So these big pediatricians can do a lot in the community. And during these COVID times, one good thing that has happened is the mother-child combo has not been greatly affected. If you see, majoritarily all the elderly and those with high risk factors are affected, but children are relatively, to a great extent spared. One of the important projects that IAP has taken up is called as Saath Saath, that is together. And this is for the perinatal care. And one of the important things that IAP did in the beginning was to bring out the guidelines for the perinatal neonatal care. And people were sensitized about the kangaroo mother care, because quite a few were afraid whether the child could be given this kangaroo mother care. And that's why these guidelines were of great help. And we also had a program called Magical Moments. Magical Moments are the days of pregnancy when the mother is really excited about the baby who is going to come into the world. And at that time, we promoted a concept of oath taking. That means the mother will take an oath that I will give only my milk and no other milk. And our people, quite a few in the rural sectors are still emotional. They believe in oath. Those in the cities, they hardly believe in the oath. But in oath-taking ceremonies, they were done at the time of either, some ceremonies during pregnancy like Dohal Jeevan and others. And the mothers usually say that I will breastfeed. And, we can take the help of all these, okay? At the time of delivery, as Dr. Deshmukh said, we have a 2 days training workshop on, of course, the online web only, that is related to the neonatal resuscitation program. And we prepared a few important posters which we sent online, and people took out the printouts, and there were 10 commandments, some of which were referred to by Dr. Deshmukh, related to asepsis, delayed cord clamping, and exclusive breastfeeding, and others. And the neonatal mortality again is abbreviated in IAP, which is infection, asphyxia, and prematurity. These are the only 3 important causes of mortality. And these can very well be prevented by exclusive breastfeeding and kangaroo mother care, that everyone is aware. And that's why for promotion of breastfeeding, we always say initiate, advocate, and protect the breastfeeding. And the kangaroo mother care as well as kangaroo father care. Now, particularly for the mothers, we always say KMC. We have told our members that it is ATM. ATM is anytime milk. And once the baby is close to the mother, it will give ATM to the baby. So we have, rather promoted certain things so that the members get an idea of what it is. As regards the immunization in the neonatal area and also giving the vitamin K, we have Immunize India, which is an app. As soon as the baby is born, we put the date of birth and any nickname like Pintu or Priyanka or something. And the child continues to get immunization alerts up to the age of 18 years, once, 3 to 4 days before the due date of immunization. And this Immunize India app is going on very well. We also brought out the guidelines for immunization so that our pediatricians are well acquainted as to what are the precautions to be taken. At the time of birth, we also promoted some ideas related to the breast sutras. We called it as breast sutras. Again, it had breast crawl. That R was for rooming in, E was for exclusive breastfeeding, A was for keeping away from advertisements, S was for the support to the mother, and T was for training. So breast sutras were given to the pediatricians, and on the 1st of August we had a webinar for the breastfeeding warriors, though, because many times, with due respect to all the obstetricians in the listeners group, many of the obstetricians are obsessed with I say HIV. HIV is not the virus, but it is the habit, ignorance, and the other various factors, particularly related to promotion of the, or rather prescription of the tinned powdered milks. So we always try to tell them that, see, keep away from these habits, and that's why some of these webinars really help. As regards immunization, we also said that we have to maintain the cold chain of the knowledge, which stands for continuous observation, learning, and dissemination of what all we know. And that's why it's important to propagate the knowledge related to immunization. And as I said, we have guidelines for immunization also. There were quite a few webinars, and Indian Academy of Pediatrics has almost more than 1,000 webinars during last 8 to 9 months, and all have been archived. And this is only for the capacity building of the pediatric fraternity and also for the parents. And one of the good things was that the parents also were taught on every Friday at night with programs in Marathi as well as in Hindi. So my dear friends, quite a few things are there. The most important thing is that our Prime Minister has already declared, Atmanirbhar Bharat. So I would say it is, as regards mother and child, it is the Atmanirbhar Ma and Matrunirbhar Balak. So both of them are interdependent. And the triple bundle to which Dr. Deshmukh alluded to, which also composes of the obstetrician, the neonatologist, and the pediatrician. So that's a triple bundle, and it can really, play wonders. So with that, I would just end my presentation with a small little story, which is a motivational story. And this is related to, a person who was walking in the desert, and he was very thirsty. And at a distance, he comes across a bore well, and he just approaches the bore well. He's very happy now that he will pump the handle and get a lot of water. But it's a rusted bore well. And on the bore well, one side, there is a glass of water. And it is written by the side that please pour this water into the bore well and then pump the handle. You will get a lot of water. Now, this fellow is in two minds as to what do I do? If I put this water into the bore well, I will lose that water. And it's a rusted bore well. If it doesn't give me enough water, again, that particular water also will be lost. But then he thinks twice and then makes up his mind, and proactively he pours that water into the rusted borewell and then pumps the handle. And to his great surprise, a lot of water is coming out from the borewell. He becomes very happy. He fills up all his water bottles, and while he leaves, he again fills up the glass of water and writes there, please put this glass of water into the borewell and then pump. It works. So remember only 2 words, my dear friends, it works. The days are changing. We are witnessing so many things, but we have to face all these challenges and continue our march forward. And I really thank the government of Maharashtra, UNICEF, and our colleagues for organizing this program. And I hope we will continue forward with a positive mindset. Thank you.
Thank you, Dr. Jog, for your encouraging words, and all the programs from Sat Sat to Immunize India to Breast Sutras for promoting different activities for the newborn and the children. Now we are very privileged. We are running a little behind the schedule, or we are going a little bit slow, but we are very privileged to have 2 very senior experts. One is Professor Sotri ma'am, and the other is Professor Irani ma'am. Before we request Bhartiya ma'am to talk about the joint statement, may I request Sotri ma'am to say a few words, and thereafter Irani ma'am to say a few words for promoting the maternal and neonatal health in the state. Sotri ma'am, over to you.
Am I audible now?
Yes, we can hear you, ma'am.
Okay. Thank you, Dr. Khanindra and Dr. Rajeshwari madam, for having me here. And as far as the role of obstetrician in improving the stagnated neonatal mortality rate, I think, hello? What is? Yeah. What the obstetricians can do is to offer preconception care at least 6 months or minimum 3 months prior to planned pregnancy. Rajeshwari madam has already stated the importance of planned pregnancy. So in this particular period, if we just concentrate on simple, inexpensive, feasible interventions like nutritional inputs to optimize the body mass index, then administer periconceptional folic acid to minimize the chances of birth defects, particularly neural tube defects, then correcting anemia before pregnancy only by iron and folic acid treatment, which is as a part of Anemia Mukta Bharat by Niti Aayog, Government of India, deparasitization also, that is albendazole treatment, then quitting illicit drugs, alcohol, and tobacco, not only by the pregnant or pre-pregnant woman, but even by her male family members to avoid passive smoking. These are the simple, inexpensive measures which can help in improving the neonatal outcome by reducing low birth weight. Government of India and Government of Maharashtra have taken a lot of efforts in improving the intrapartum care by training all the health professionals in Maharashtra in Dakshata training, which is essentially quality peripartum care. So from admission to labor room till discharge after childbirth. So in this, the main 2 tools that have been used, like partographic monitoring and use of safe childbirth checklist, these have been now strengthened as a part of Lakshya certification program, and these are also incorporated in Lakshya Manyata, which is exclusively meant for private sector, which Dr. Nandita Prashetkar has already referred to. And these are going to improve the quality of intrapartum care, which is going to have probably the highest impact on neonatal survival. And these guidelines have also given the directives to use the medicines like uterotonics, that is the medicines which enhance the uterine contractility rationally, antibiotics use rational, the surgical interventions use also rationally how to practice this. These guidelines have been there. Then additionally, task shifting. Now in all these programs, what is happening is the peripheral healthcare workers are now able to grasp some of the skills in newborn resuscitation in the first golden minute. And even the small private nursing home gynecologists are happy that their staff is now confidently giving the essential care to the newborn in the first minute until the pediatrician or the neonatologist arrives. So there are various initiatives under various programs, and lot of training inputs have gone in, lot of guidelines have been prepared, and I think the stagnated neonatal mortality rate is surely going to show a significant decline in the years to come. Thank you, sir.
Thank you so much, Sopri ma'am. You have been one of the key persons for improving the obstetric care in the government system, for the rollout of the preconception care, for even the Laksh Mainyata program in the state. So thank you so much for your kind words. Now, may I request Simin Irani ma'am to say a few words about the neonatal health promotion with home-based KMC and other activities. Over to you, Irani ma'am. Irani ma'am, are you there? Can you hear us? I think there is some internet connectivity problem maybe. Then over to you, Phadke ma'am, to basically guide us about the joint statement that we have drafted and why it is so critical to join hands and work together for further reduction of the maternal and under 5 mortality and neonatal mortality in the state. Over to you, ma'am.
Honorable and esteemed friends who have gathered here, and a wonderful workshop arranged by the UNICEF, Rajeshwari Madam, Raji, Dr. Khanindra, Mangesh, Dr. Karnatki, and many others from the UNICEF who have done so well since morning to celebrate. And we have gathered here to celebrate the National Newborn Week, commencing from 15th to 21st of November, to focus and draw our attention to a small little newborn who we think by giving good care, he will survive and thrive. Dr. Pramod Jog, so rightly, one of my best students, he said that the governments, the UNICEF and the national and international bodies, the IAP, FOXY, NNF, are like the right and the left brains, and there is a good joint and a connection. I might add and say, not only are we the right and left brains, but we are also like right and left hands. And so with hands, today is the time for us to work and put our hands together and put our skills together. The national and international luminaries like Dr. Nandita Palshetkar so beautifully said that as obstetricians, and Shrotri Madam said, what you will all do to bring a newborn. And therefore is the theme for today, to ensure quality, equity, and dignity to the newborn. And I thought that I will just enlighten and highlight little bit on what we mean. Everybody has already said that. What do we mean by quality? I believe it is the birthright of every newborn to get quality care. And what is that quality care? If he just needs level 1 care, or if he needs no care, a good delivery and mother's milk, and he's at home, fine. But otherwise, right from level 1 to level 3 care. And there is the acumen of Dr. L.S. Deshmukh, who told us how a good level 3 care can make long queues for mothers and babies to come to his hospital. So good level 1 to level 3 care will be the first quality care that we would like to deliver. From community-based to facility-based newborn care, through establishments of good SNCUs, that is special newborn care units, to NICUs, the NICUs, and to get quality care from people like Asha to all the DM neonatologists and the pediatricians and obstetricians alike. What do I mean by equity? So we get quality for all our newborns. What do I mean by equity? Sure enough, There is equity for rich and poor alike. All the urban slums that we saw in the film are an absolute eye-opener to see what happens to the newborn in the urban slums. So there should be equity in matters of getting good neonatal care to rich and poor alike. Needless to say, girls and boys, and needless to say, of all religions, castes, and communities. And the dignity, how is the dignity? The dignity of being conceived. The newborn must be conceived at the right time, not when the mother is just 15 years of age or already had 3-4 children, no family planning done. So the conception has to be perfect, with good care of the mother to be taken in the antenatal period, and institutionalized delivery, and let the baby have the dignity of the mother's milk, which is so important. Dignity in exploiting the innate growth and developmental potential of the baby is very, very important. Everybody has said, Dr. Simeon Irani in the morning told us that kangaroo mother care is going to give brain to the baby. Now, needless to say that unless we exploit the developmental potential to the fullest, the baby is not going to be a good adult delivering its best. We have to change the beginning of the story, then only we can change the whole story. So this is what we have done, but our story is only half done. Why is it half done? Because last mile we have to reach. We brought down the maternal mortality ratio from 166 to 46. The infant mortality rate was brought down from 42 to 22. Neonatal mortality from 25 to 13. But now we are nearly stagnating the neonatal mortality. We are not doing good enough. And besides, we have the burden of COVID on us. And this COVID-19 has done everything, has left us terribly in a very bad shape, in the sense economies have gone down, people cannot go to consultants, no health services are now available little bit, but not really so. And therefore, we have to strengthen today. If we don't do that, it is said that our under 5 mortality may increase even as high as 44%, and MMR may increase as high as 38% from what it is now. So we have to act right away. And what do? Start from the adolescent girl. A good BMI, body mass index, not too thin, not to look at the actors and actresses with 0 figure, which may be important, but a BMI less than 18.5 is not going to do any good. No anemia, and correct age at marriage. We may prevent low birth weight baby. That's going to be an important theme for us. And it is disheartening to know that Maharashtra is doing even worse than India in matters of low birth weight. So where are we now? We have to stop this intergenerational cycle of a poor anemic mother with low BMI giving birth to a low birth weight baby, and she in turn becoming a mother, a stunted mother, and giving rise to another low birth weight child. So this intergenerational cycle has to stop. How does it stop? We run our RMN CHA program well in full swing, have a continuum of care and a life cycle approach. We cannot miss the preconception care, and folic acid tablets to be given to a mother to be pregnant or to a woman to be pregnant is important. Now in facility-based newborn care, let us see that there is a newborn care corner everywhere, right from villages to urban areas. We have to have them in the labor rooms with trained staff and good equipment. So Dr. Jog's example of a small water tap was important. So let there be equipment which is in place, and we have to feed it with good trained staff so that the labor rooms are full with good newborn care, newborn stabilization unit, NBSU, and we may have SNCUs wherever required, special newborn care with 12 beds. All district hospitals have good SNCUs, but it's a little not so heartening to know that many medical colleges still do not have SNCUs and they don't have NICUs. There are few which have the best treatment available, but we still have to go a little ahead and see that they're established. Let us also establish a mother and newborn care unit. You cannot separate the mother from the newborn, even in COVID times. So it's important to see that a COVID positive mother, not so unwell, is going to feed the baby, taking all COVID precautions. And so we will not separate the mother and the newborn, and we will give all the possible health facility-based care to the mother and the child. Let us also see that home-based care is given And how do we give it? Both in rural and urban areas. One by the ASHA, up to 42 days, home-based newborn care, HBNC, and home-based young child care, that is beyond 42 days up to 15 months of life of the baby. Needless to say that all nutrition programs have to be in place for adolescent girls, iron folic acid, midday meals, Amrut Ahar Yojana, and IYCF practices. I would also insist that good IMNCI, integrated management of neonatal and childhood illness, has to be taught and has to be rejuvenated again. It was in function many years ago. Now we'll have to revive it. Urban areas, private practitioners have a very, very big role to play, and they are doing their job so well. All our national bodies have come together. And I might say that the immunization, which has dropped down in COVID times, we have to enhance the immunization. And that is one more thing that's going to make our newborn thrive. So let us all join hands. I congratulate the UNICEF and government of Maharashtra for me taking out the joint statement, and we all wholeheartedly take a pledge for the survival of the newborn. And we may take not only baby steps, but we will see that our newborn sooner or later not only thrives, survives, but also thrives well. Thank you so much.
Thank you so much, Farke ma'am. You have always been our guide, mentor. At all the times, you have provided a lot of technical support, lot of guidance, lot of insight, lot of facilitation. Thank you so much. Now, the next session is interaction with the media, because we know that many of the behaviors related to early initiation, related to exclusive breastfeeding, related to keeping the baby warm, related to the accessing the health facilities on time so that there is no delay. So these are at the individual level behaviors which have to be promoted. So media has a very big role to play in this regard. So next couple of minutes, actually, we'd like to focus interacting with the media regarding the maternal and newborn healthcare, regarding the COVID-19 situation. May I request Swati to moderate this session, interaction with the media? Swati, over to you.
Yeah, I'll just come in. After this session, now since the presentations are over, we would like to take questions from any one of you. So please come forward, say your name, and you can ask the question which can be answered by our panelists. Thank you.
And also we'd like to request our media friends to cover this event as widely as possible so that there are...
Yeah, Khanindra, there is a request that people who have presented their presentations, you know, the PPTs, we need to share with them. So after this meeting, we'll just take it forward. Yeah.
Thank you.
Sure. Yeah, thanks. Any questions from anybody on this, on the panel discussion that we had?
Can I come in?
Yeah, Raji.
Yeah,
good afternoon. I am from Bhundi.
Good afternoon, Raji.
Good afternoon, Farke ma'am, Mirani ma'am, Dr. Joe, Dr. Deshmukh, and Dr. Palshetkar, and all the other colleagues here, and also Mr. Abubakar, editor. So I think it's been a very good, so let me introduce, I'm Raji Nair. I handle nutrition for UNICEF Maharashtra. And this is a very relevant topic because we are talking about the first 1,000 days, which is the critical window of opportunity. And how do we really continue to invest and make first 1,000 days reality, both in the families and communities and in the facility? And I think if that is put in the perspective, perhaps we may see lesser babies born low birth weight and all. So the whole thing is, how do you make communities and families aspire for make birth weights, growth and development aspirational? How can we really do that? My experiences working in the communities and all, what really goes across to the mothers and caregivers, they may not realize the physical stunting, wasting per se, because in a community, if I'm staying in a community where most children around me are of same height, I may look at it as a norm. But the issue is, what really happens is that what families do understand and families want to really look at is, how do my child perform well in the school? How do my child do very well in academics and in job? So the whole argument is ki mala hushar baal paije. Okay, they may not really look at that all. So this whole translation of hushar, how do you make it as a reality? How do you look at the whole, which Dr. Deshmukh and others all said, the whole issue of stimulation and the neurodevelopment and everything? How do you really start bringing this as part of the counseling package for antenatal care mothers? How do you really bring about that, why we need to invest and why it is important that you start looking at these core messages. And I completely agree with Phadke madam, who said that IMNCI has taught us, what has worked very well. Because what is very beautifully done in IMNCI are simple algorithms, simple tools, which even not an educated, even a Anganwadi worker or Ashas who's got 10th standard or less than that understands and is able to reach out to the families, counsel the families, and ensure breastfeeding is established, care and support and nourishing. So bringing together the nurturing and nourishing and creating a bond is very, very critical if we really want to talk about providing the best possible start for a newborn. So that is something, and as rightly used the word by Madam, is that how do you give dignity to birth? How do you make mothers aspire and say, yes, this baby of mine will do well? How do we really do that? Because it's almost so many years we have moved and we are now at a last mile. Like we still have 20% or 25% of the babies born low birth weight, but that is a Maharashtra average. But if you go down to the districts and if you go down, you still have 50% of the babies born low birth weight. You go to Nandurbar, you may go to, so there are points, delivery points where you still have 50% of the babies born low birth weight. What can we do at family level? What can you do at community level? And what can you do at the facility level? And how can people who are the, how gynecologists, pediatricians can play a role, both at facility level, and how can our frontline functionaries play a role in making healthy newborn a dream come true for every poor mother. So how do we really put that, and how do we really, I like the way Dr. Jog gave very nice analogy, and I wish Dr. Jog, if you can give more such, we will be happy to take it and run with it to the families and communities, because families understand those kind of language, So how do we really take it forward and do it? Because why I'm having this conversation again is like, we do have children with wasting, commonly use the word SAM. And Maharashtra has 17% of its children under 5 wasted. That is weight for height less than -3 standard deviation. We have 5.2% of the children who are severely wasted, where they may be less than -4 standard deviation. Now, where does it begin? So one is all your low birth weights translate into your wasted children. Then you have the newborns who are born healthy but become wasted. So there are different factors. So how do you, and we are now discussing this whole concept, and Phadke madam is leading along with Irani ma'am and everybody, is to look at how do we manage and prevent children from becoming wasted in under 6 months. Because then you have lost. Because it's not just physically, but it's also their brain development is affected. So what you will do is basically helping them to grow physically, but whatever losses have happened cognitively can be really. So I'm just putting this across to all the esteemed speakers and media group and people who are, how do you package, how do you position newborn as an aspiration of mothers and caregivers? in the most poorest communities. Thank you very much.
I have a question. I'm Anuradha from the Indian Express. My concern is because COVID-19, children have been spared to a large extent, according to one of the panelists. So when the vaccine does come out, frontline healthcare workers are going to be given the vaccine. So what is the associations and the healthcare people, what is their take on, giving the vaccine to the pregnant mothers? And what is the advisory and what is the concern? Because we are saying that COVID-19, because of that, Dr. Phadke ma'am said that MMR and the IMR, it just may go up. So I just wanted to ask regarding that. Thanks.
Ma'am, you will be the better person. I'm not technically from that field. So I think I would hand over to the esteemed panelist.
Yeah, hi, this is Dr. Nandita Palshetkar. It depends on the vaccine. If it's a live vaccine, it cannot be given to pregnant women. Pregnant women can only be given a dead or attenuated vaccine. And the swine flu vaccine, which we have, we do give it to our pregnant girls. So it depends on the type of vaccine that is released. If it is safe in pregnancy, we would advocate it during pregnancy. But so far, all the research that has come out has been showing that pregnant women do not react very badly to it. There's only one paper which was released in November, a week ago, which is saying that it does affect women and all. So we're waiting for more research on it. But I think my take is that if the vaccine is safe for pregnant women, we will definitely be giving it to them.
Thank you.
On the type of vaccine. Okay, thank you. I think, Raji, the answer to your question is what we are actually doing with the organization and what government is actually doing with Lakshya. In Lakshya and in Lakshya Manyata, the 16 clinical standard care, one of them includes antenatal care, and we have a package for nutrition so that the nutritional education is given to the mother. And this training is imparted not only to the doctor, but all the paramedical staff and the people who are helping. And this is upgradation of the antenatal care and the delivery package to the mother and child in the public as well as the private sector. And believe me, Raji, the government is working very, very aggressively to get all the hospitals Lakshya accredited, and that includes that. And in the private sector, we have got about just 200 centers in Maharashtra which are Manyata accredited, and we are working very hard. I think what you need is sensitization of the doctors and advocacy that these various tools are available. Last year from Foxy, we had created, a tool on nutrition, how to improve the nutrition of the mothers. And we had actually targeted, along with the Neonatology Forum, the first 1,000 days. So I think we have a lot of tools available. It's just that we need outreaches. Dr. Jog's outreach is different, my outreach is different, Madam Phadke's outreach is different. So we all need to work in our different ways to reach out to people, and I think we will then be able to achieve that.
Can we take a few more questions from the media, if that is?
I think Mr. Abu Bakar wanted to ask a question.
Yes, madam.
Please.
न्यूबॉर्न बेबी के ताल्लुक से जो सेमिनार बहुत अच्छा चल रहा है, हमने दरमियान से ही सुना है। लास्ट टाइम इस तरह का एक प्रोग्राम नासिक में हुआ था, उसको हमने अटेंड किया था। इसी टॉपिक पे वो प्रोग्राम था, बहुत सारी बातें हुई। हम हमारे भिवंडी के डिस्ट्रिक्ट थाना में जो सिविल हॉस्पिटल, उस ताल्लुक से कुछ कहना चाहते हैं कि ये कोविड-19 के पीरियड में 48 डिलीवरीज हुई वहाँ पर, जो कोविड पॉजिटिव लेडीज की हुई हैं, और ऐसा हुआ है कि सारे बच्चे कोविड निगेटिव थे, किसी को इस तरह का कोई प्रॉब्लम हुआ नहीं था। और वो थाना डिस्ट्रिक्ट में बहुत ही बड़ा काम हुआ है, वहाँ के डॉक्टरों ने, हॉस्पिटल्स ने बहुत केयर किया। और ये जो आपका प्रोग्राम है बहुत अच्छा चल रहा है। हम चाहते हैं कि भिवंडी में भी हमारा जो IGM हॉस्पिटल है, यहाँ पर बहुत ज्यादा इस तरह के मामलात हैं कि वहाँ पे प्रॉपर डॉक्टर नहीं है, लेडीज सर्जन नहीं है, वहाँ पर डिलीवरी वगैरह के मौके पर लेडीज डॉक्टर्स नहीं रहती हैं, जेंट्स डॉक्टर डिलीवरी करते हैं। तो इस तरह के बहुत सारे प्रॉब्लम्स हैं। तो ये जो बच्चों का मामला तो है ही है, उस पर ये वेबिनार है, लेकिन ये बच्चों के मामला माँ से भी रिलेटेड है, फैमिली से भी रिलेटेड है। तो आपकी एनजीओ अगर यहाँ पर भी थोड़ी तवज्जो दे, सुजाता मैडम भिवंडी आती रहती हैं और इन्होंने बहुत सारा यहाँ पर काम किया है इस ताल्लुक से। हमारी रिक्वेस्ट है कि आप हमारे शहर पर भी थोड़ा तवज्जो दें, बस इतना मैं कहना चाहता हूँ। और ठीक है।
Hanindra, you'll say something to this.
आज सुबह भी ये बात हुआ था कि भिवंडी में बहुत होम डिलीवरीज हो रहा है। एज यूनिसेफ हम लोग ये इशू गवर्नमेंट तक ले जाएंगे और कोशिश करेंगे कि जो भी नेशनल अर्बन हेल्थ मिशन और हेल्थ डिपार्टमेंट का अलग अलग प्रोग्राम है उसको भिवंडी में कैसे इंटेंसिफाई किया जाए। ओवर फ्रॉम माय साइड।
ओके ओके ओके, थैंक यू।
और कुछ सवाल हैं किसी के? Or else we'll send all the materials to everyone. I think that would be good. The joint statement and the PPTs will share with everybody.
Excuse me, ma'am.
Yeah.
Ma'am, I'm from Malegaon. जी हाँ जी, I'm from Malegaon.
हाँ
मैम एक्चुअली मीटिंग तो काफी अच्छा हुआ है, कोई प्रॉब्लम नहीं है, बट जैसे कि जो प्रेजेंटेशन में जो दिया है, तो अगर आप प्रेजेंटेशन में मेल आईडी शेयर किए हों आप
हाँ
उस पे अगर शेयर कर देंगे तो पीपीटी से हम
सारे पीपीटीज और जो जॉइंट स्टेटमेंट है अमजद जी, हम आप सबके साथ जो यहाँ पे हैं, बिकॉज वी आर ऑल्सो रनिंग अ लिटिल लेट, जितने भी आज आए हुए हैं हम सबके साथ शेयर जरूर करेंगे सारे पीपीटीज।
और दूसरा है कि जैसे कि आप बताएं कि होम डिलीवरी भिवंडी का जो इशू है, खनिंद्र सर और मैम स्वाति मैम आपके लिए, होम डिलीवरी का इशू सेम मालेगांव का भी पैटर्न सेम ही है, और मालेगांव कॉर्पोरेशन के पास अभी तक कोई डेटा नहीं है कि होम डिलीवरी किन किन इलाकों में होती है। तो थोड़ा अगर आप कॉर्पोरेशन को थोड़ा इसके ऊपर वो करते हैं फोकस, तो कुछ रिजल्ट निकल के आएगा होम डिलीवरी को लेके।
खनिंद्र, आप कुछ कहेंगे इस पे या और कोई ये सवाल लेना चाहेगा?
नहीं, सुबह से ये बात हुआ है कि जो प्राइमरी हेल्थ केयर है उसको स्ट्रेंथन करना है, तो उसके लिए हम लोग स्टेट गवर्नमेंट के साथ काम करेंगे, लेकिन यूनिसेफ डज नॉट प्रोवाइड सर्विसेज ऑन इट्स ओन बिकॉज वी डू नॉट हैव आवर ओन health system or a parallel health system. All that we can do is to provide technical support and do advocacy. And we have been working in both these municipal corporations for promoting routine immunization for a very long time. And we'll take forward these issues to the government, and we'll see how we can improve the health post, the urban primary health care, the urban community health center, so that many of these deliveries can be handled at the health post or the primary health center level. Over from my side.
Okay, I think
and data be got from the birth registry, because every birth has to be registered. Do they register first of all? That's what I would like to know, because if they register, then the birth data is registered there, which hospital you registered in. So that data can actually be taken in from those the birth registry of each ward or each district which has it when you get a birth certificate. And once the digitalization of the health data occurs, which Prime Minister Modi ji has promised us, maybe then it'll maybe much easier.
Sure, ma'am. But the situation is that in both these municipal corporations, the public health system is little bit weak, and say in भिवंडी only one civil hospital is there. The health post, there has been a lot of efforts to strengthen the urban primary health centers and community health centers. Because of some or the other issue, the progress of all those health centers have been slow. So we'll see, because we know that there are a lot of home deliveries which are taking place in भिवंडी as well as in Malegaon. That information is known. We can find out also the areas from where the home deliveries are taking place. How to strengthen.
Probably the midwifery
Dr. Khanindra.
started.
Yes, sir.
Can I come in?
Sorry.
Deshmukh ji, please.
In relation to that home delivery thing occurring in Malegaon and Bhiwandi, it is the thing which needs to be addressed very urgently, because you see in the rural health services there are very good structure, but in urban areas it's always an issue with inequity of the health services provided depending upon the areas. And it is still very surprising, despite being corporation areas, there are home deliveries which are occurring there. There are not only these two districts, but there are many other districts are there. So it is a little bit larger issue of home deliveries occurring on one side. The hospital deliveries are going up to 80s and 90%. And still there are 10, 15, 20% home deliveries which are occurring.
Do you think the midwifery will actually solve this little bit when the government has already started training and conducting the courses?
I think so. I think that will be the game changer for this country in terms of providing the quality care to the normal, non-high risk.
Providing the numbers.
Yeah. But it will take time, maybe another 5 to 10 years. But till that time, we have been advocating that the skilled birth attendance programs needs to be scaled up in a very big way in both these municipal corporations, so that even if there is a home delivery, if we can send one skilled birth attendant who is a staff nurse, then the quality will be much better. But that also has not taken off due to some or the other constraint.
No, but anyway.
पूरा भाव से माल पीछे है और पूरा बिखरा आ गया.
So if there are no questions.
Yeah, Khanindra, I think we'll be anyway sending the materials at this point. I don't think, there would be any questions because we have asked everyone. So if there are any questions which will come to us as emailers, we'll take it up later. Yeah, we can wind up. Any more questions from anybody, or we can, we'll send the materials to all of you. And if there are any questions, you can also get in touch. Thank you.
Thank you so much, Swati. This is the concluding session now. And I'd like to be very grateful to all the speakers, all the office bearers, the presidents and the past presidents of the professional associations, Professor Palsetka ma'am, Dr. Deshmukh sir, Professor Pramod Jog sir, senior pediatricians and obstetricians, Sotri ma'am, Parke ma'am, Irani ma'am, for participating and guiding us what are the key actions that are to be implemented for preventing the maternal and newborn mortality in the state in the aftermath or in the midst of the COVID-19 pandemic, which has disrupted the entire society, the entire health services, the income, the livelihoods, so much problem that has been created by COVID-19 pandemic. I'd also like to be very grateful to the UNICEF team under the leadership of Rajeshwari ma'am for providing this opportunity, and the teamwork within the office between the health, the nutrition section, the CAP section, the C40 section, the urban section. And finally, I'm very grateful to all the persons from media, the journalists who have participated, listened to us very patiently. And I'm very hopeful that this event will be widely covered so that more and more people know about the healthy behavior during the preconception period, the antenatal period, know about the importance of delivering at a health facility by skilled birth attendants, and know about the behaviors like early initiation, skin-to-skin contact, exclusive breastfeeding, identifying the danger signs. Thank you so much for all the participants, all the district consultants, the state level consultants, and other colleagues from the UNICEF office who have participated and made this event successful. Thank you so much once again. Thank you. Over.
Thank you.
Thank you.
Thank you.
Thank you, everyone, on behalf of UNICEF. Nice to have you. on board.
Thank
and
you.
hope to work with you again on the issue of newborn care. Bye-bye.
Bye.
Thank you, everybody. Thank you.
Thanks, Dr. Phadke.
Yeah.
Thank you, Phadke ma'am.